So You Want to Change the World, a podcast sponsored by the UNLV School of Public Health. This podcast is designed to highlight some of the outstanding work of our faculty, staff, and students, and how public health changes our world, our community, and improves our quality of life. Well, hello, I'm Shawn Gerstenberger, Dean of the UNLV School of Public Health. And I'm thrilled today to be able to share some public health stories about how our faculty, staff, and students are out changing the world. And today's guest is Dr. Brian Labus. Brian is an assistant professor here at the UNLV School of Public Health, although he had an interesting path of getting here and coming back. So we're thrilled to hear a little bit about Dr. Labus today. He's an expert in communicable diseases and has spent a lot of his recent time talking about pandemic-related issues. So welcome, Dr. Labus.
Hey, thanks for having me.
So you've had quite the experience in your career, starting in public health, coming back, and then really being a leader in the pandemic. Could you tell us about a few of the interesting things that you've got to do in your career?
Prior to coming to UNLV, I spent 15 years at the health district, and I don't think people realize the wide range of diseases that some of the people there get to work with. Anything that happened in Southern Nevada, I was part of for a decade and a half. The best way I explain it is somebody was giving a tour to some new people around the building, and they got to outside my office and said, "This is epidemiology. They deal with weird things," and then moved on down the hall. And that was basically my career. Anytime something interesting happened, I got to be part of it. Legionnaires outbreaks on the Strip, big norovirus outbreaks with thousands of people, anything that happened, measles, salmonella, whatever it was. The biggest thing I worked on was a hepatitis C outbreak where we had a medical clinic that was improperly using their multi-dose vials, wound up exposing 63,000 people to the blood of other patients, resulted in about 115 infections and a couple of deaths, and the doctor that ran that clinic actually went to jail for murder. So I got to do everything from the initial surveillance all the way through testifying in a murder trial and in civil trials that resulted in billions of dollars in judgments against the companies involved. And until COVID, I thought that was going to be the biggest thing that I ever did. But obviously that's changed in the last couple of years, but it's kind of been all over the place. I get to work with a little bit of everything, which makes it fun. It's not the same thing every day. The diseases change, the methods change, and the ability to help the community changes every single day.
Well, it certainly sounds like an exciting career. I'd like to dive in a little bit deeper into a few of those areas. Often when we think about public health, it's been in the news now. We think everybody does the exact same thing, but it's a really broad career. And we get the privilege of being able to help people where they're at, to improve their quality of life, prevent diseases, and do some exciting things. Maybe we could talk a little bit more about that hepatitis outbreak.
Sure.
And get into a few more details, because I think that's a great example of how public health professionals really, really make a huge difference. So could you tell us a little bit about kind of how you discovered this was happening?
Well, I won't take credit for discovering this one. It was discovered because we have a system set up to specifically discover things like that. Every time somebody develops hepatitis, whether it's A, B, or C, it gets reported to the health department. And those things each get investigated by a disease investigator. And we happen to have two disease investigators who recognized that they had worked on a case of hepatitis C that went to the same clinic. And early on, that didn't necessarily mean anything because the clinic provide colonoscopies. That was what they did. And that's a common procedure for older people. So the fact that both people went there didn't necessarily mean anything. We had to figure out if that was significant or not. And for us, we weren't really sure. So they had procedures on different dates. There wasn't anything overlapping other than the fact they went to the same place. So we called the CDC, and I'm actually on a phone call with the CDC as I get an email from one of the investigators that said a third case just came in. I'm going to try and call them right now and find out if they went to the clinic. And a few minutes later, I got a follow-up email that said they were there the same day as one of the other cases. So we'd identified 3 cases of acute hepatitis C that went to the same clinic, 2 on the same day. We normally expect between 2 and 4 cases of acute hep C a year in Clark County. So right there we said, okay, this is clearly above what we'd expect. And it really made us focus in on that one clinic as a problem. You had to know that something was going on right now, which is the disease surveillance piece, but there's also putting it in context. We had to know what was normal for hep C. So using all of the previous work that we did, we can compare what we were seeing now to what was normal for Clark County and say, this is out of the ordinary, this requires some investigation.
So that's the fun part about public health, right? It requires all these systems to work together and communicate, to identify problems, look at locations.
And it really brings in skills from all sorts of different areas. Everybody on our investigative team at the health district brought something unique to the team. If everyone had the same set of skills, it wouldn't be great. My background was more on the informatics side. I did epidemiology, but I also was good at manipulating data. But we had other people with more social work backgrounds. We had people that were from the lab side of things and some with environmental health backgrounds. And all of those people working together bring something unique. And that's what's fun about public health. You get to work with people that are very different than you. You have the same goals, but your background, your history, your experience is all different. And that all comes together to allow you to do something to help the public.
Well, that's a good little segue into shortly thereafter, you decided to come back to school, right? You had a master's of public health with an emphasis in epidemiology, and then decided to come back actually to UNLV to pursue your PhD. So why then? Why at that time? Why were you inspired to go get that PhD then?
Well, the big event that inspired me to get the PhD was the fact that UNLV started the PhD program. I was part of the school very early on. I remember going to lunch with you and Mary Guinan and Chad Cross, probably one of the first people you talked to about coming to teach at UNLV. And so in the spring of 2006, I started teaching. And every time I would talk to Mary, she would say, when are you going to get your PhD and come back and teach for us full time? And I would always say, when are you going to offer a PhD? And so finally, when that happened, I was able to come over here, start the PhD program and do that. Because ultimately what I wanted to do is go beyond where I was at. I love doing the outbreak investigation, the disease surveillance. The thing that I didn't get to do as much was the teaching. I really enjoyed working with students, and getting the PhD would allow me to move into an academic role where I could still do the things I was doing before, but pick up that teaching and mentorship side that I was really excited about doing.
Well, you certainly transitioned into an academic role, right? And soon after transitioning into that assistant professor role at UNLV, this crazy COVID thing happened, right? And so you have been clearly at the forefront of this, not only for the School of Public Health, but for UNLV and really for the state. So can you tell us maybe just a little bit about some of the key initiatives and things that you've worked on with respect to COVID and COVID prevention and surveillance and decision making?
When COVID started, I wasn't sure what my role in this was going to be, since I was not part of the health department anymore. But I got a call from the governor, and he asked me to be on his medical advisory team. And that was my first big step in being part of something. I was also part of all of the UNLV responses. Nobody knew who I was at that point, and I got invited to the first meeting. I walked into the room and thought, I don't know anybody here. Everybody's several steps above me. I hope I fit in. And by the end of the meeting, they were all turning to me and saying, okay, what should we do? And it really called on all the experience I had of not just dealing with diseases, but responding to an outbreak. One of the questions I got early on is, how do you seem so calm in all of this? And it was because I've done it hundreds of times. It wasn't a new thing to me. COVID was new, but outbreak investigation was the same. Kind of the rhythm of an outbreak and how it plays out, knowing what things are important, what things are minor. You learn those things over time from actually doing it. So for the last 2 years, I've done all sorts of things related to COVID. I had a team of over 250 investigators led by graduate students. And that's the thing I'm proudest of, that it was a student-run team. We investigated over 40,000 cases of COVID in Southern Nevada. It was 1 out of every 6 cases in Clark County. And the team of students, 18-year-olds, were calling families of people who had just died and interviewing them about COVID so we could find out what the risks were and what was happening in our community so that we could stop it. That's probably the thing I'm proudest of during this entire pandemic, is the work that team did. The team was named the Outstanding Public Health Program of the Year by the Nevada Public Health Association, and all sorts of students have gone on from that team to full-time positions. That was the hardest thing I've had over the last few months, is people leaving and taking jobs everywhere else because we trained them well and now they could go out and do great things in the world, which is exactly why they're here. And it's sad to see them go, but it's quite gratifying to know that those students are in that much demand for important positions throughout our state.
Yeah, for sure. I know that team's had a tremendous impact here and the community. I think, what was it, 1 in every 4 or 5
1 in every
cases?
6.
One in every 6 cases in Clark County basically was investigated by that team of those students that worked for you, those public health and healthcare administration students that were learning under your direction and being taught how to deal with a real live, real-time pandemic. Once in a lifetime experience, right?
And it wasn't just public health students. We had students from all over campus. We had students from different science backgrounds, liberal arts, nursing, health sciences, all sorts of different areas. We got to expose a lot of people to public health. And even if they don't go into public health ultimately, they're going to take the lessons they learned with them. They're going to think about that when they're dealing with their communities and their populations. They're going to think about that when they look at who they're going to vote for. They might maybe want to find people who share the values that they've learned now in public health, and we can help make the world a better place just by exposing more people to what we do.
Yeah, I think that's a great example for some of our students, right? When they're trying to figure out what do they want to major in? What do I want to be? How do I want to go out and impact communities, change something that maybe wasn't in such a great situation that happened to me? They often think about, I'm going to be a nurse, I'm going to be a doctor, I'm going to be a physical therapist. All those are wonderful careers, but we want to put public health on the radar and get them thinking about this is a profession where you can go out and you can make a difference. You can change the world. You can impact people's lives on a daily basis. So I'm curious if you had some students that came in there and just kind of had those aha moments, like this is what I want to do or this is what I want to be, that maybe wouldn't have had that experience had this pandemic not happened.
I've definitely had that. We've had a lot of students say to us, I wasn't thinking about public health. Now they're applying for master's degrees in public health. We've had students who just did it because it was a job and found out this is something really they were passionate about. So they wound up changing their major into public health. Now, that's not everybody. Some people are going to take that public health into whatever they're learning, which is great. People that are in nursing school and understand public health are people that we need out there. You don't have to major in public health to work in public health, but we've definitely had people decide this is what they wanted to do. Kind of that moment in their life where they said, I found the right thing for me. Just like I did at one point in my life, some of those students found it and said, this is the job I want to do. I love this, and this would be an awesome career.
So what advice would you have for someone who's maybe taken a public health class, heard about it on TV or social media or whatever they're looking at, said, I want to explore this public health career? What advice would you give to them? What would you tell them to do? How would you tell them to find their way into this career?
I would say to find something you're really passionate about, and it will probably overlap with public health. You may be a computer coder, and there's something you can do in public health for that. There's an entire field of public health informatics where you take those skills and use them in the context of public health. You could enjoy doing field work where you're collecting specimens out in the world and bringing them back to the lab and doing the lab testing. There's jobs in public health for that. The best teams that I've been part of have brought people together from a lot of different backgrounds. And in my graduate classes, I always have the students work together on class exercises for this reason, because everybody brings those unique skills that they have to the team, and that's what allows the team to succeed. Even it's just working at Starbucks when you were in high school. Well, you've worked in a food service setting. You understand how those things work. You understand customer service. You understand working with people and part of a team. And people tend to underestimate the value of a lot of those jobs because it really makes you an important part of the team because you bring something that other people don't have. Your experiences are what make you unique, and you can bring something into public health. You don't necessarily have to even be a public health major to do that. You can think about it maybe as going to grad school in public health, no matter what your undergrad degree it was in. Mine was in biology. That's how I found my way into public health. But I work with people that had all sorts of different backgrounds.
Yeah, I think that's very true. We actually have a sign on our building on the wall, not too far from your office, that says there's really nothing that is beyond the realm of public health. It all links back in some way. And I think that's one of the things that inspired me, and it sounds like you, to get into public health, is the interconnectedness of that field and the disciplines that you have to know to be a good public health professional. So one thing I'd love to hear from you is at some point in your career, somebody kicked you down the right path, right? They gave you the talk, they pulled you aside, they put you in the lab. I don't know what it is, but I'd be curious, what was your turning point where you kind of knew that you wanted to go into and pursue a career in public health?
My last semester as an undergrad, I was looking for classes to take, and I found a class in epidemiology, and I thought, okay, this sounds interesting. I didn't need to take it. It was just a pure elective class. It wasn't even in my department. And I signed up for that class, and after about a week, I said, this is what I want to do. Dr. Black was a professor of that class at Purdue, and he kind of took me under his wing. And so we started talking about graduate school. I was thinking I was going to go to med school. I didn't get in, which was the best thing that ever happened to me because I would have been a miserable doctor. I didn't want to work with patients. I didn't want somebody throwing up on my shoes. I wanted to take care of sick people, but I didn't want to spend time taking care of sick people that same way. I like the population aspect, and I really like microbiology. So that was where I was coming from, kind of a more population-based approach. And working with him, he encouraged me to go to grad school. Basically, I took the GREs. We sat down, looked at all the schools, figured out which ones I was applying to. And that was really that class and working with him. That was the thing that sent me down the path to public health.
Well, thank you, Dr. Black, right, for doing that inspiration. And I'm sure that you have been that Dr. Black to a lot of people here at UNLV already, inspiring them down their career, down their path, finding their passion. And that's what we're here to do. That's what the UNLV School of Public Health is designed and set up to inspire and make happen. So I want to thank you today, Brian, for spending some time with us. But I really want to thank you mostly for the impact that you've had on our community, on our students, on the decision-making for our state, for your pandemic response, and for really going out, changing the world.
Well, that's what public health's all about. That's the best part of working in this field is you can make a difference. It's also nice if you have a short attention span like I do. I can work on something for a few weeks, and then the next day I can start on something completely different. And all of those things can lead to a community that's better for everyone. It's really an enjoyable field to be in. You don't get a lot of recognition, unfortunately. If you're going into a career to be recognized, to be famous, to make lots of money, public health is not the field for you. But if you want to finish your day and look in the mirror and be very proud of what you did, it is a great profession to go into because that's what we do. We spend our time trying to make the world better for everyone else, even if no one notices. The best things that we do are things that nobody else notices. We prevent disease. Nobody counts cases that didn't happen, and it makes it a little tough to get funding if that's the case. But we always want to make the world a better place, whether people know it or not. And we measure that by things that didn't happen. If we can keep people from getting sick, it really makes the whole job worth it. It makes it a lot of fun to be part of a response, even if it's something horrible like COVID. It's not like we want outbreaks to happen, but if this happens, I'm glad I got to be part of it. I'm glad I got to do something for my community. Yes, it's fun to do TV interviews and all that and be locally famous with my friends and family, but that's just a side part of it. For me, every time I do an interview, it's a chance to educate somebody. It's a chance to teach somebody. One of the proudest moments I had during the pandemic was I was on a radio show, and a woman called in and had some questions about the vaccine, and I answered her questions, and she said, "Great, I'm going to go out and get vaccinated right now." And it was one of those moments where it's like, wow, I actually changed somebody's behavior. That's really great to be able to do. And those are the kind of the small victories that really mean a lot to us in public health. We're doing what we can to protect the community, even though if we're not always appreciated, we're always there trying to make the world a better place.
Yeah, for sure. It's awesome when those things happen because we know behavior change is hard. Well, again, thank you. If you want to find out more about Dr. Labus and the work that he's doing, you can, of course, go to the UNLV School of Public Health. That can be found on our website, unlv.edu/public health. You can look for us on Facebook, Twitter, Instagram, or other social media resources. And look for future broadcasts on more exciting faculty, staff, students, and community partners that are out there changing the world, just like Dr. Labus. Thank you for your time today. We appreciate you, and we really have enjoyed our discussion with you today.
Thank you.